called ICSI, where you see sperm 400 times big. And once a baby is ready, you put it in an incubator, which is an open system. Daily you take the baby out, check under the microscope for development and put it back. With this, the success rate is around 65%. And highest technology means you see sperm 7,000 times big. That is called IMSI. And once a baby is ready, you put it in an incubator, which is a closed system, that is called the embryoscope. So this is like the human body. So the quality of the embryo is much better. Also, there is an inbuilt program, which actually inbuilt camera, which actually takes pictures of embryos automatically every 10 minutes. Software then analyzes all this data, and then it gives marks to the embryos, 80, 90, 100 marks. So the embryos with the top rank, then you select, and before you put it back into the uterus, you actually before you put it back into the uterus, you actually use the laser, thin down the shell of the embryo, coat it with something called embryo glue, which is a sticky substance. Then you put it back into the uterus. Your success rate now increase up to 80%. And this is called high technology IVF. Sometimes when you suspect that there can be abnormalities, the patient has had an abnormal baby earlier, in that case we use the laser, take a few cells, send it for genetic testing, choose the normal embryos and put it back into the uterus. So these are all the things which we find. Now there's one important point. Now suppose the baby has come out 24 weeks. Then in this situation, before the pregnancy is conceived or before they plan the pregnancy, we actually laparoscopically put a stitch. This is called laparoscopic cervical cerclage, where we put a stitch at the level of the mouth of the uterus at the highest point and strengthen that so that the miscarriage does not happen at that stage of pregnancy. Sometimes we put in a second cerclage below when the patient is around 13-14 weeks if there is a problem with the external part of the mouth of the uterus. So this is called laparoscopic cervical cerclage, and the number of miscarriages have grossly reduced, and hardly we get any miscarriages. We have done more than 250 procedures. Only 3 of them had deliveries at 24-25 weeks, and all of them went on to 36, 37, 38 weeks. So we are very, very happy with the results of this procedure. Now what do we do after we put back the baby? Now we have to actually support the baby. And how do we do that? We give injections to maintain the blood in the liquid state all the time. Number 2, we also give medicine to prevent rejection of the embryo. Number 3, we give injections to reduce the natural killer cell in the lining of the uterus, which actually destroys babies. So when we do all these things, then the baby helps the baby to go through the pregnancy and continue growing till you get a baby in your hand.
So ma'am, what to do after repeated failure and IVF failure?
Okay. Now we have lots of patients who keep coming and telling us, I have done IVF 3 times, 4 times, some of them even 10 times, but they have failed. So this is something which we have given a lot of importance to, because it causes a great emotional burden on the patient and also a financial burden. So step number 1, you should first take the file from the patient, take a very thorough history, find out all the procedures that they have gone through. How many eggs, how many cycles, how many embryos were formed, what was the quality of the embryos, was there any difficulty in transferring the embryos, and finally how many times they failed. So after that, then we try to improve the egg count and the sperm count. So how do we do this? We give medicines to improve the egg count, and we also tell them to do a little bit of yoga and acupuncture. If they are obese, we tell them to reduce their weight, and we give medicines to improve the egg number and quality. If the egg number is very low, then we suggest stem cell PRP into the ovaries before we start the process. Now the next thing is about sperm quality. We look at the sperm quality. Sometimes they have excellent count, but their movement is very slow and the structure is very bad. So we want to improve all the things before we actually start. So we give medicines to do that. And if it doesn't respond to medicine, if they have a varicocele, then we correct the varicocele laparoscopically. If after all this the sperm count does not improve, then better to go in for ICSI. And ICSI means you take the sperm out inject the sperm into the egg, form the baby and put it